Often people think of focus as holding a camera still and adjusting the lens for a clear picture of an unmoving object. That is not the meaning of focus in the title of this book. Rather, focus refers here to a complex dynamic process of selecting and engaging what is important to notice, to do, to remember, moment to moment. Much as a careful driver focuses on the task of driving a car in heavy traffic by actively looking ahead while also checking mirrors, observing road signs, braking, and so on, all while monitoring dashboard gauges, keeping in mind the speed limit and destination, and ignoring the temptation to look too long at interesting sights. A person employs this very active, rapidly shifting, repeatedly readjusted deployment of attention and memory as the focus needed to plan and control ongoing activity. Such focus is extremely difficult for the 7 to 10% of the world's population who suffer from a syndrome of cognitive impairments, currently known as attention deficit disorder, ADD, or attention deficit hyperactivity disorder, ADHD. Syndrome is a term that describes a cluster of symptoms that tend to appear together. For example, nasal congestion, sore throat, headache, fatigue, and fever often appear together as a syndrome commonly referred to as a cold. One single cause, or a variety of different causes, might lead to one common syndrome. In this book, the term ADD syndrome is used to refer to a cluster of impairments in the management system of the mind. The DSM-4, the Diagnostic Manual of the American Psychiatric Association, describes currently accepted diagnostic criteria for attention deficit hyperactivity disorder, ADHD. The concept of ADD syndrome, introduced in this book, is not intended to be a new diagnosis, replacing existing diagnostic categories. I am simply proposing a new way of looking at these impairments, in which many, but not all, are encompassed in current diagnostic criteria for ADHD. Other labels have been proposed for this cluster of impairments: attention deficit disorder, executive dysfunction, minimal brain dysfunction, regulatory control disorder, and dysexecutive syndrome, to name a few. The concept of ADD syndrome described here includes many impairments described by these various labels, impairments that often appear together and tend to respond to similar treatments. Compared to others of the same age and developmental level, persons with ADD syndrome tend often to have an unfocused mind, not only for driving, but also for many other important tasks of daily life. This does not mean that persons with ADD syndrome are never able to focus adequately, nor does it mean that those without ADD syndrome are always well focused. ADD syndrome is not like pregnancy, an all-or-nothing status with no in-between. It's more like depression. Every person feels sad sometimes, but a person is not diagnosed and treated for depression simply because he feels unhappy for a few days, or even a few weeks. It is only when depressive symptoms are persistent and significantly impairing that the diagnosis of depression is appropriately made. Similarly, persons with ADD syndrome are not constantly unfocused, but they are much more persistently and pervasively impaired in these cognitive functions than most other people. My purpose in writing this book is to describe more adequately the complex ADD syndrome as it occurs in children, adolescents, and adults. My understanding of ADD syndrome is not universally accepted. Some researchers prefer less cognitive, more behavioral models to describe this disorder. In these pages, the reader will find a new, somewhat controversial understanding of ADD syndrome, including how it can be recognized and how it can be treated effectively.